Learning peripheral venipuncture can be a stressful time for you and your child. We will help support you and your child to learn how to administer treatment at home. A home treatment regime will help establish a safe and effective routine for your child and the family. Good hygiene is vital. Washing hands, disinfecting surfaces, and using non-touch techniques. Choosing the right place and environment can help your child to feel safe and reassured. Encourage your child to help you set up and prepare all the equipment needed for the procedure. Use distraction, such as a favorite TV show, tablet game, or storybook. When applying the tourniquet, ask them to help you by keeping their arm in position and finding their veins. When you have chosen a suitable vein, clean the area. Your child may also want to help prepare their own treatment. Continue distraction. Some people like to sing a song. Prepare treatment as you've been shown and prime the butterfly needle with Factor. You will be trained how to apply a tourniquet. Clean the area and insert a butterfly needle. Administer Factor as you have been trained. Praise your child for helping and sitting still. Once administered, draw the needle out and apply pressure to the site with gauze for 2 to 3 minutes. Talk to your child about what went well. Dispose of sharps safely and disinfect surfaces. Reward your child for good behavior. Encourage use of sticker charts or reward certificates rather than toys and food. It is helpful to reinforce positive behaviors, such as sitting still.